Thank you so much. So yes, I'm the CEO of Maternity Foundation. We are a Danish NGO with a mission that no woman should die giving life. Every second minute, a woman dies during childbirth. That equals 2 jumbo jets full of pregnant women crashing every day. At the same time, every 10th second, a newborn dies around the time of birth. 99% of these deaths happen in developing countries, which actually makes it the area within health where we see the highest inequality globally. The good news is that 90% of these deaths are actually preventable with some fairly simple interventions. It's not a matter of investing in high-end equipment, facilities, or even doctors. First and foremost, it's a matter of making sure that the women give birth with a skilled birth attendant who have the basic skills and knowledge in terms of handling childbirth emergencies. However, at the same time, as we speak today, around half of the skilled birth attendants across, for example, sub-Saharan Africa lack these basic skills and knowledge. So how can we reach these health workers and empower them with the important skills and knowledge? The mobile phone revolution does have a great opportunity here. And that's why we have developed the Safe Delivery app in a collaboration with the University of Copenhagen and University of Southern Denmark to be able to reach these skilled birth attendants with essential knowledge and skills through an app. What we have done is that we have boiled down the global guidelines into some really, really simple animated instructions, which has then been tested in a number of Delphi groups globally. The Safe Delivery app today consists of videos, guidelines, drug list, practical procedures, and then a learning module which step by step, through quizzes, will make sure that the skilled birth attendant knows everything that they need to know within this area. But that's all great, so you can put all that into an app. But does it work? Can you use an app to build critical skills and knowledge? In order to find out about that, we had a randomized control trial back in 2014 in Ethiopia, across 120 facilities, half control, half intervention. And what we saw was, in the intervention group, the health workers more than doubled their skills and knowledge in terms of handling these key interventions. Also, more qualitative, what we saw was that the health workers found more confident, more empowered, and they found it very easy and practical in the day-to-day life. Based on these results, we launched the app in 2015 and made it freely available on Google Play and in App Store. And then started to really, disseminate this tool and create awareness around it. It was clear already from the beginning that there must be an unmet need, because we did get a lot of attention, which of course is great, but even more enabled us to start engaging with key partners around rolling this tool out. But obviously, we are facilitating this tool, but the core implementation and ownership needs to be driven on a country level with key partners. We work, our different partners work in different ways in the way that they're integrating the tool. Everyone can download this, but then we work more strategically with the national partners on integrating the app into existing health system efforts. This is a simple, small tool that easily can become a part of existing programs. So for example, in Laos, the tool is already introduced pre-service, so that once the midwives are educated, they can bring the tool into the field. In India, the Safe Delivery app is introduced as a part of some short introduction trainings, and it's going to be rolled out across all states in India, actually, so that's really exciting. In Myanmar, it's introduced on tablets as a job aid for 14,000 health workers this month. In addition to working in more stable settings, we're also working in humanitarian settings with partners to get it out where there is no strong and established health system already. So far, we can see the app is used in around 40 low and middle income countries. It's been downloaded around 35,000 times, and we have 20 implementing partners working on this. But this is not really about technology. Even when we started this, we didn't know anything about technology. This is really a matter of finding out the best way to access these health workers and support our partners in doing so. So it's a matter of working with the national partners on adapting the app. It's a matter of making sure that we learn from across in terms of the implementation models and get a lot of data that we are using and sharing back with the community. So what is next? So we are in the next round of funding, we are looking for $1.5 million, which will enable us to bring the Safe Delivery app to scale in the 5 priority countries where we're working at national level, and in addition, across the many different countries where it can be used more as a standardized tool for download. So our ambition is within that funding period, which is 2019 to 2022, is to have reached 100,000 health workers, and thereby having ensured a safer birth for around 20 million women. So that's what this is about. Thank you so much.